Atenolol is a medication primarily used to treat high blood pressure, hypertension, and certain heart conditions such as angina, chest pain, and heart attacks. Here are some benefits of atenolol. Hypertension management. Atenolol is effective in lowering high blood pressure, reducing the workload on the heart, and helping to prevent complications associated with hypertension, such as heart attacks and strokes. Angina prevention. It's used to prevent angina, chest pain, by reducing the frequency and severity of episodes. Atenolol works by decreasing the heart's workload and oxygen demand, thereby reducing the likelihood of angina attacks. Heart failure. In certain cases of heart failure, particularly when there's a component of systolic dysfunction, atenolol can be beneficial. It helps to improve cardiac function and decrease symptoms in some patients. Arrhythmia control. Atenolol can help regulate heart rhythm, particularly in conditions like atrial fibrillation or ventricular arrhythmias, by slowing the heart rate and stabilizing electrical activity in the heart. Postmyocardial infarction, heart attack. Treatment. After a heart attack, atenolol is often prescribed to reduce the risk of recurrent cardiovascular events. It can improve survival rates and reduce the likelihood of further heart damage. Migraine prevention. Atenolol is sometimes used off-label for migraine prevention. It's believed to reduce the frequency and severity of migraines, possibly by stabilizing blood vessels in the brain. Anxiety control. Atenolol's ability to reduce heart rate and blood pressure can be beneficial in managing certain symptoms of anxiety, such as palpitations and trembling. Thyroid storm management. In cases of thyroid storm, a life-threatening complication of hyperthyroidism, atenolol can help control symptoms like rapid heart rate and high blood pressure until definitive treatment can be administered. Performance anxiety. Some individuals may find atenolol helpful in managing symptoms of performance anxiety, such as stage fright, by reducing physical manifestations like sweating and trembling. Glaucoma. Although less common, atenolol eye drops are sometimes prescribed to lower intraocular pressure in certain types of glaucoma, thus helping to prevent optic nerve damage and vision loss. While atenolol is generally well tolerated by many people, like all medications, it can have side effects. Here are the top 10 potential side effects associated with atenolol. Bradycardia, slow heart rate. Atenolol can cause the heart rate to decrease, leading to bradycardia, which may result in symptoms like dizziness, fatigue, and fainting. Hypotension, low blood pressure. Atenolol can lower blood pressure, which may cause symptoms such as dizziness, lightheadedness, and fainting, especially when standing up quickly. Fatigue and weakness. Some people may experience fatigue, weakness, or a lack of energy while taking atenolol. These symptoms can impact daily activities and quality of life. Cold extremities. Atenolol can cause vasoconstriction, leading to reduced blood flow to the extremities. This may result in cold hands and feet, as well as numbness or tingling sensations. Sleep disturbances. Atenolol can disrupt sleep patterns in some individuals, leading to insomnia or vivid dreams. Sleep disturbances may affect overall well-being and daytime functioning. Bronchospasm. Atenolol can worsen respiratory conditions such as asthma or chronic obstructive pulmonary disease, COPD, by causing bronchospasm, leading to symptoms like wheezing, chest tightness, and difficulty breathing. Masking of hypoglycemia. Atenolol can mask some of the symptoms of hypoglycemia, low blood sugar, particularly tachycardia, rapid heart rate, which can make it challenging for people with diabetes to recognize and treat low blood sugar levels promptly. Depression and mental fog. Some individuals may experience mood changes, depression, or cognitive impairment while taking atenolol. These effects can impact emotional well-being and cognitive function. Gastrointestinal disturbances. Atenolol can cause gastrointestinal side effects such as nausea, vomiting, diarrhea, or abdominal discomfort in some people. Sexual dysfunction. Atenolol may contribute to sexual dysfunction, including decreased libido, erectile dysfunction in men, and difficulty achieving orgasm. These effects can have a significant impact on quality of life and may affect adherence to treatment. It's essential to discuss any potential side effects with a healthcare professional before starting atenolol, as well as to report any adverse reactions experienced during treatment. In some cases, adjustments to the dosage or alternative medications may be necessary to manage side effects effectively. Using atenolol effectively involves following your healthcare provider's instructions carefully. Here's a general guide on how to use atenolol. Dosage. Take atenolol exactly as prescribed by your doctor. The dosage may vary depending on your condition, medical history, and individual response to the medication. Administration. Atenolol is typically taken orally, usually once or twice daily. It's important to take it consistently at the same time, each day to maintain stable blood levels of the medication. Follow instructions. Follow your doctor's instructions regarding the timing of doses, whether to take it with food or on an empty stomach, and any other specific guidelines. Do not stop abruptly. Do not stop taking atenolol suddenly without consulting your doctor, as this can lead to rebound hypertension, heart rhythm disturbances, or other adverse effects. Your doctor may need to gradually taper your dose if you need to discontinue the medication. Regular monitoring. Your doctor may periodically monitor your blood pressure, heart rate, and other relevant parameters to assess the effectiveness of atenolol and monitor for any side effects or complications. Continue. Even if symptoms improve, even if you start feeling better, continue taking atenolol as prescribed unless instructed otherwise by your doctor. Stopping the medication abruptly can lead to worsening of symptoms or other complications. Avoid alcohol and certain drugs. Limit alcohol consumption while taking atenolol, as it can enhance the medication's effects on lowering blood pressure and heart rate. Also, inform your doctor about any other medications, supplements, or herbal remedies you are taking, as they may interact with atenolol. Store properly. Store atenolol tablets at room temperature, away from moisture and heat. Follow any specific storage instructions provided by your pharmacist. Be consistent. Try to take atenolol at the same time every day to maintain a consistent level of the medication in your body and maximize its effectiveness. Emergency situations. In case of a medical emergency, such as severe chest pain, difficulty breathing, or fainting, seek immediate medical attention. Atenolol should not be used to treat acute symptoms of heart attack or other emergencies. Always consult your doctor or pharmacist if you have any questions or concerns about how to use atenolol properly. They can provide personalized advice based on your individual health needs and circumstances. Thanks for watching the video. Don't forget to subscribe to our channel for more health tips and information.